Hello listeners, it's Monday evening once again and it's time for Views on Health. A more welcome to Dr. Indunil Piyadigama, Senior Lecturer in the Department of Obstetrics and Gynecology, Faculty of Medicine, University of Colombo, and Honorary Consultant Obstetrician and Gynecologist at the Dizoiza Maternity Hospital, also in Colombo. Warm welcome to our studios, Doctor, back with us again. And the topic that you want to discuss today is ectopic pregnancy. Over to you, Doctor.
So we thought we'll discuss about ectopic pregnancy. So basically what ectopic pregnancy means is a pregnancy that is not happening at the correct site. You all know that when you're getting pregnant, the baby should be within the womb. So that's where all the protection, nourishment and everything will happen, and the baby would be able to grow up to what we say at least to term, that is up to 40 weeks, and to be able to safely deliver the baby. But in an ectopic pregnancy, what happens is the baby is not properly placed within the womb cavity at the proper place. Most of the time this is outside, so outside the womb. Rarely this can be in the womb, but in a kind of a abnormal place where the baby cannot grow further. So as I said, most of the time it is outside. Mostly, as a lot of people might have heard about it, it occurs in the tube itself. So we call them tubal ectopics. So why are we worried about an ectopic? Is, as I said, if there's an ectopic pregnancy, obviously we wouldn't be able to have a normal outcome of a pregnancy, that is to have a healthy baby. But more than that, on top of that, what is worrying about ectopic pregnancy is because it's at an abnormal place, when the baby starts growing, or the initial, what we call the fetus starts growing, there isn't enough space. So because of that, there can be damage to the structure that the baby is lying inside. So suppose it's within the tube can rupture. So if the tube ruptures, there's a great risk for the mother. That's because there'll be a lot of blood that is supplying the tube that will come out of the place, and that will fill up the tummy itself. So when the blood is not leaking outside of the vessels, basically they will go into collapse, what we call, and even some very rarely mothers can even die because of an ectopic pregnancy. So that's why it's very important to talk about this.
How soon can you detect this condition?
Ectopic pregnancy we can detect very early. So basically now we talk about in pregnancy in weeks. So when somebody gets pregnant, we calculate the dates from their last menstrual period. So within about six weeks itself, most of the time 5 to 6 weeks, or even just after 6 weeks, we should be able to diagnose whether it's an ectopic pregnancy or whether it's a pregnancy that is at the proper site. So emphasizing that this 6 weeks is very early. So only the baby is developed only into a we'll say maximum about 2 to 3 millimeters, and with the sac everything would be about less than a centimeter. So the way of detecting where the baby is by doing a ultrasound scan. So when we do a ultrasound scan, especially what we do is a internal ultrasound scan, that is a transvaginal ultrasound scan. From that we can detect where the baby exactly is. So that's the best way to know. So basically the message that can be given is, when somebody gets pregnant, it's always better that you have a scan as early somewhere around 6 weeks, so that we can confirm where the baby actually is.
So this is a situation that is not very welcome.
Yes.
But it can happen. How common is it, Doctor?
It's kind of common. So basically if we take, we see about 1 in 100 So that is, if you take 100 pregnancies, one woman will have an ectopic pregnancy. So considering the number of pregnancies that happens in a country or in a year, that's quite a high number.
And so how do you deal with it?
So basically, as I said, most of the time this occurs in the tube, and if it ruptures, then of course it's going to be a lot of trouble. Suppose it depends on how early that you diagnose. Suppose that there can be two categories, in the sense you would diagnose very early and you find from the scan that the pregnancy is not at the proper site, or else somebody would come with symptoms and rupture, and then we would find out that it's causing trouble. So if the ectopic pregnancy has ruptured, so that is given away, the only option that we have is surgical. That is, we have to enter into the abdominal cavity and then find where the bleeding is and arrest the bleeding. In current nowadays, that is most often done with a laparoscopy. What we say is, in other words, it's a keyhole surgery, unless it is a very bad situation where somebody is almost like dying, where we wouldn't have enough time to do all this kind of preparations. So what we do is a laparoscopic surgery to arrest the bleeding. But if we detect someone early, then of course we can manage it without surgical options. So we may be able to give them a special medication which will sort of stop the growth of the pregnancy that is outside. So therefore we prevent it being bigger and rupturing whatever the structure that is there. So that way we can sort of manage if we detect early.
But at the end of the day, doctor, it's the management has to continue throughout the pregnancy. Any pregnancy you have to manage the mother, the pregnant woman rather. But in this case, you need more attention or more sort of methods of managing, because the pregnancy is outside. And does that give the woman concerned any discomfort, any added difficulties?
So basically, this is, once we detect, we kind of manage it within, maybe if it is not that urgent, maximum within about a couple of weeks, we finish the management. So there's no kind of continuation from there onwards. But if somebody has an ectopic, so that means there must have been some sort of predisposing reason for that person to have this kind of condition. Therefore, even though we have completely managed during this pregnancy, it's wise that we should to be vigilant, because in a next pregnancy also a similar situation can come up. So therefore, in that way, somebody who has had an ectopic pregnancy needs careful observation if they're going into a future pregnancy.
But you will manage it throughout the period of pregnancy. And then in such situations, is a normal delivery...
So, Fatima, this one, ectopic, is basically, once we diagnose it, we kind of remove the pregnancy. In the sense, we are not going to continue the pregnancy. Do you understand? Right. So basically, it's a very high risk for the mother if we continue the pregnancy. So therefore, what we do is, we basically get rid of the pregnancy.
So you terminate it?
Yes. That is, we can't call it termination, but what we do is, either surgically or giving medicine, we stop this pregnancy going on.
From proceeding.
So basically, we either surgically get it off, or we give medicine so that it doesn't grow further. So that way we terminate this pregnancy, and then we go on for a future pregnancy with careful observation. That's what we do.
How would the patient react to this?
So this is kind of a very difficult situation, especially that is a very good question, because somebody especially, like, suppose you, because nowadays the pregnancies are very precious. People delay pregnancies and wait for a long duration, and then they want to get conceived. And when it happens, they are very worried about, or very, very concerned about the pregnancy. So this is obviously a very worrying thing, because ectopic pregnancy, a lot of people actually know that it can be life-threatening. And on the other hand, the treatment for ectopic pregnancy, most of the time, although I said there are two arms, most of the time is surgical. And most of the time it occurs in the tube. So that means when we do the operation, we not only remove the ectopic, we also take out that tube itself, most of the time. So because of that, that is also a concerning feature for a woman who is planning to have future pregnancies. So because of all this, it's a very kind of a stressful and an anxious situation. And also, you don't want to go into surgery or very nasty medications when you get pregnant for the first time. So that is also adding up to the picture. So therefore, now what we understand is, for an ectopic pregnancy, if it happens due to a defect in the tube, keeping that tube may not be beneficial, because in a future pregnancy also it can come and lodge at the same time and cause trouble. But if we think that we can salvage this tube, or maybe she only have one tube because of previous kind of infection that has damaged, or previous surgery or whatever thing, if she has only one tube, and if the ectopic pregnancy had occurred there and we need surgical treatment, we can kind of do what we call it salpingostomy, where we only make a little cut on the tube, take out the pregnancy, ectopic pregnancy, and again resuture this tube back into its place. That is also possible. So that is the other way of managing, rather than just removing the tube. So overall, in a surgery, if you remove a tube, if the other side is normal, that wouldn't really get your chances, or that wouldn't really compromise you getting pregnant in future. Even if you do a opening and resuture, you still have a high chance of getting pregnant in a future pregnancy. More than 70% of the women will have a natural pregnancy or normal pregnancy without any complications after surgical procedure.
Would you advise them on a waiting period? You've gone through this problem. Should you wait X number of months or year, whatever, before getting pregnant again?
So that depends on the site, in the sense, now I was only talking about a pregnancy in the tube. But sometimes this pregnancy might happen in the side of the womb itself. With technical terms, we call it a cornual pregnancy, where you might need to make a cut on the womb itself to take off this pregnancy. Or it might occur in a previous C-section, or when a woman has had a previous C-section, this pregnancy might come and lodge within that scar on the womb. So in that situation, we might need to cut off the scar and then repair it. So if that kind of situation happens, then for the womb to come back to its original strength, we advise them to wait for at least about 6 months, and sometimes it's about 2 years, depending on the cut and where the cut is. We might ask them to wait longer. But if the ectopic was not within the womb, it's outside, we can ask them to get pregnant as soon as possible. It's not a problem. As soon as they have overcome their sorrows and like they are psychologically fit enough to have a pregnancy, they can. On the other hand, there are some people we treat with, certain medications for ectopic pregnancy. So these medications, why we treat it for an ectopic pregnancy, the medication is these medications are extremely toxic to the developing baby. So because of that, if these medications are given, it's wise to wait for a period so that this medication gets washed away from the body, so that for a future baby or a future pregnancy, that there wouldn't be any residual effect of the medicine for the future pregnancy. So depending on that, we'll ask them to wait for a future pregnancy.
Doctor, I don't know if this is a fair question. Take a case where there are twins. Could such a pregnancy take place if it's ectopic, one in, one out, or both out?
Yes, that is a well-known entity. We call it a heterotrophic pregnancy, where you get a normal pregnancy within the womb and another pregnancy at an abnormal site. So there comes the situation where we do all sort of measures to make sure that the baby at the normal site grows well and we are able to have a healthy baby. The abnormal site baby will definitely have surgical treatment and removal, so that there won't be any bad effect on the baby that is at the normal place.
Thank you, Doctor, because from a lay perspective, that is something that we will wonder, is it possible? And if so, how does it happen? So time is catching up with us. Doctor, what is your take-home message?
So basically, ectopic pregnancy is a common condition. And most of the time these pregnancies occur in tubes, and when the pregnancy happens in a site that is not the ideal site, there can be complications, especially which is life-threatening to the mother. So therefore, you have to be very vigilant. When you get pregnant, it's always advisable within the first few weeks to get a scan, so that to confirm that the pregnancy is within the normal site. And some of the people, if you get delayed, or like if you are unable to get access, one of the earliest signs of an ectopic pregnancy is pain. So if you are pregnant and getting undue abdominal pain and bleeding, either pain or pain and bleeding, then it's best that you seek medical advice and confirm where the pregnancy is before doing anything further.
Thank you, Doctor. With such good advice, we end this interesting discussion on ectopic pregnancy. To you, Dr. Indunil Piyadigama, Senior Lecturer, Department of Obstetrics and Gynecology, Faculty of Medicine, University of Colombo, and as an honorary consultant obstetrician and gynecologist at the De Souza Maternity Hospital, also in Colombo, we say thank you very sincerely. Thank you, Doctor.
Thank you. Thank
you too to Prabhavira Surya for technical assistance. I'm Fatima Razika saying good night and looking forward to your company next Monday, same time on Views on Health.